What's good, everyone? FDA approval. Let's talk about it. So, if you're deep into the biohacking world like I am, you've probably heard about retatrutide, the triple agonist peptide that is showing insane weight loss results in trials. Up to 30% body weight loss in some studies. Plus big improvements in blood sugar, osteoarthritis pain, and more. But here's the thing that stops a lot of people cold. It's not FDA approved yet. And even though the research has been going on for years, plenty of biohackers are still nervous about touching it. So I'm going to break down exactly what FDA approval means in our space, why retatrutide is stuck in limbo, and how to think about the risk-reward when something that looks this promising isn't quite yet on pharmacy shelves. First, let's demystify what FDA approved really means, especially for biohackers who are always chasing the next edge. Now, the FDA approval process is the gold standard safety and efficiency gatekeeper in the US. It's not just a rubber stamp. A drug has to survive. Phase 1, which is a small group, it's mostly about safety and dosing. Phase 2, bigger group, does it actually work? And Phase 3, thousands of people, randomized, placebo-controlled. Long-term data on safety, side effects, and real-world benefits. Then the company submits a new drug application with manufacturing details that meet strict good manufacturing practices. Then the FDA reviews everything, sometimes for 6 to 12 months or more, before saying yes, this is safe and effective for this specific use. Once approved, doctors can prescribe it, insurance might cover it, and compounding pharmacies have clear rules. But here's where biohacking gets interesting and a little gray. The FDA process is slow and expensive. Think hundreds of millions to billions. And it's focused on specific indications. But biohackers don't always wait. We read the published trial data, watch the phase 2 and 3 results roll in, talk to clinicians running the studies, and sometimes decide that the risk-benefit looks good enough to move forward with research-grade or compounded versions. And that's exactly what happened with earlier GLP-1 drugs. Semaglutide was approved for diabetes years before the weight loss indication. Tirzepatide followed a similar path. The biohacking community jumped on the data early because the science was compelling, and real-world use matched the trials. Now let's talk about retatrutide specifically. It's a first-in-class triple agonist. It hits GIP, GLP, and glucagon receptors. That extra glucagon punch is why it's showing even bigger weight loss than the dual agonists in head-to-head data. So, should you wait? That's a personal decision. Like for me, I started taking it a year and a half ago. I lost 25 pounds in 2.5 months, and since then I have been weekly microdosing at 1 milligram. I love taking little maintenance doses just because it helps with my snacking, cuts down that food noise. Keep in mind that it has multiple benefits such as promoting gut health, being an anti-inflammatory, helping with fatty liver. It's known for preserving muscle. I mean, I could just go on and on about how much I love this peptide, but that's not what this video is about. Now, the realities in biohacking. The data so far is extremely promising. Better than anything we've ever seen. Similar drugs already approved have changed lives for people who are struggling with obesity and metabolic issues. Many biohackers argue that waiting years for bureaucracy can mean missing the window when the science already looks solid. The key is informed consent and source quality. Please don't get your peptides off of TikTok. Like, are you serious? Retatrutide is a perfect example of how new exciting science moves faster than regulators. The nervousness is valid, but the early results are legitimately game-changing for a lot of people. What do you think? You gonna wait for the FDA green light, or are you gonna jump on board with the rest of us? As always, this is not medical advice. This is for entertainment and educational purposes only. All right, y'all, stay informed and have a great day.